Today, I'd like to talk about a couple of cases lately that have really broken our hearts, and they both involve families with dementia patients inside facilities, one inside a skilled nursing facility and one inside a hospital. The patient that was referred to us by one of our local attorneys was a very sad case. The wife was desperate because she couldn't get through to the skilled nursing facility. Nobody would talk to her. Sometimes they'd return the call the next day. Sometimes they wouldn't return the call at all. Her husband has dementia and serious mobility issues. He wasn't safe to go home. So unfortunately, he had to go to rehab. But here's something that I want to point out. When families listen to hospital care managers about where to send the patients to, always beware, because hospitals are highly financially motivated to send patients to those skilled nursing facilities in their post-acute network. And ladies and gentlemen, post-acute network skilled nursing facilities are not always the best. In this case, this poor man was sent to a place locally that I know is nothing more than a factory. They have very high infection rates, very poor staffing ratios, and this poor man was in tears almost every day. When am I going to get out of here? When am I going to get out of here? Well, he was exposed to COVID through an employee of the facility. The wife did not find out until 5 days later. So when I got involved, I did some advocacy and got him moved to a high-quality skilled nursing facility, and he's actually doing quite well there. After 3 weeks in the first facility, he couldn't even do stairs. In the second facility, within 3 days, he was able to do stairs and getting stronger and stronger every day so he can go home. So always be a little bit careful. That's where having a patient advocate or a care manager in your back pocket really makes a big difference, because we know the lowdown. We know where the good, awful, mediocre facilities are in the community, and we make it our business to develop relationships with the highest quality. The second one was a very sad case at a large hospital down towards Chicago. This 81-year-old executive went into the hospital with an intracranial bleed, a stroke. He was there for a couple of weeks and got really good care in the neurointensive care, but when he went to the regular floor, one bad thing after another started to happen. So his wife called us, and we actually had to do some serious fighting to get him into a quality skilled nursing facility. And unfortunately, since they had tied down this man and restrained him, those notes about restraints made most of the high quality facilities refuse him. So ultimately, they just forced a transition plan to a place that we knew was horrible. And we had advised the wife, do not agree for this patient to go to this facility. But they sent him out within 24 hours. This large man fell straight backwards and cracked open the back of his skull. He had to go back to the emergency room. So here we have a man that was forcibly sent to a skilled nursing facility that provided poor care and oversight. He cracked his skull open and got a subdural hematoma, a bruise on his brain, after he had already had an intracranial hemorrhage. So stories like that just really keep me up at night. They really make me upset. So if you don't know what your rights are as a patient or a family member of a patient, give us a call. We might be able to help. Thank you.